common one that people talk about on Holly's Army is gabapentin. I just wondered if you could have a little bit of a chat about gabapentin as a drug.
Yeah, I think it's always important to mention that vets will always be using the licensed drugs first, and usually they're going to want to try a non-steroidal anti-inflammatory first, and that does have some effects on neuropathic pain where it's been caused by chronic pain inflammation, and so it's still relevant. So your dog may well be on a non-steroidal anti-inflammatory, but then that's not controlling the situation, and you need to add something else. And there's various drugs available, and the one that's being used an awful lot at the moment is gabapentin. It's not usually my first choice if there's arthritis present. We can talk a little bit about some other drugs in a minute. But if we specifically suspect neuropathic pain, then gabapentin is definitely worth trying. So basically, it works in the central nervous system, and it is quite complex. And I'm definitely not going to go into the full detail because I will be with you for 3 hours if we do that. It really works as a. So do you remember I said about about the accelerator, pain and chronic pain causing excitation being like an accelerator on a car? So if you imagine you've got your foot stuck down on the accelerator and the car's going faster and faster and faster, gabapentin really is interrupting and slowing down the signals in the central nervous system so that you take your foot off the accelerator. It's not putting the brakes on as such, but it's actually removing that acceleration excitation. And we're starting to learn more about exactly where it acts in the central nervous system. It has other effects, so it causes sedation, and it also is an anti-seizure drug, all because it's slowing down the central nervous system. It's slowing down those connections and signals that are firing around the central nervous system. So that includes epilepsy and alertness. So sedation is a side effect. And then you mention, or certainly I've seen mentioned a lot, that wobbliness or ataxia is the technical term. Well, it's not the proper term, but anyway, not being quite coordinated in the gait, and maybe even appearing to be weak in the muscles and things like that is a common complaint when dogs are put on gabapentin.
Yes.
And there are ways that we can resolve that, and it's mainly a problem with starting the dose quite high, which potentially you need to do if you want to gain control of a very painful dog. But in most situations with chronic pain, it's not appropriate to start the drug really high. So we, certainly in humans, they start the drug at a really low dose, and then they gradually build up over a period of weeks. And that way you get less of those side effects with the sedation and the wobbliness.
Yeah. I've in my experience as well with some of them where it's just a mild wobbliness, it can take 2 or 3 days, and then suddenly day 4 they seem brilliant. So generally, if it's not terrible, I might persevere with it. But again, it's very case dependent. But I know that is one of the worries that people have on Holly's Army. And in an instance where they are having a dog who is very wobbly, what sort of things should they be doing? Obviously with their vet, but what's the way to tackle that?
I think the first thing is not to be frightened of it, because it's not harming the dog in any way other than if you're talking about dogs' arthritis in context, quite often these dogs are quite weak already. They've got muscle loss and they've got painful joints. So the only danger with the wobbliness is that they can injure themselves further because of not being quite coordinated. And an absolute classic would be dogs that are having to walk around on slippery laminate floors, which is a bugbear of mine, which obviously CAM is probably a central theme of CAM, is to avoid that situation. But you get a dog with hip arthritis, muscle loss and weakness, and then add to that some incoordination and sedation, weakness with gabapentin, and the dog being on a laminate floor, you've got a perfect storm. If they do the splits, they're going to injure themselves, and that's the danger. That's probably the only danger. People are very frightened of it because they've never seen their dog like this before. It's like they've just woken up from a general anaesthetic or something.
Yeah.
So I think what to do in that situation is to call your vet and ask if you can reduce the dose a bit and then just gradually increase it until you get the desired effect. Something else is quite